Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. Did you know that every year thousands of Americans have a cosmetic surgery and they seek out so-called bargains in foreign destinations including Mexico, Central and Latin America, and elsewhere? Our guest today says that these patients do not know that having plastic surgery abroad can sometimes be a case of buyer beware. My guest today is a board-certified Beverly Hills plastic surgeon, Dr. Dan Yemeni of Visthetic Surgical Institute and MedSpa. Dr. Yamini wants to alert all of us to the dangers of foreign cosmetic surgery versus the relatively safe and controlled surgical environment normally found in the United States. Dr. Yamini, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you, Jeanine. It's nice to join you guys.
So it's good to have you to really give us some clarity on this topic. Tell me a little bit more about you and why you decided to dedicate your career to cosmetic surgery.
Well, I've always been passionate about healthcare and healing. I had a background in biology and psychology back from Stanford. And at first I thought I was going to go into psychiatry. Then I fell in love with surgery. And now I joke that I'm a psychiatrist with a knife. So I dedicated my life to helping people feel better about themselves and their lives by plastic surgery. And a lot of times it's not cosmetic. It's really to help improve problems they've had over years or after pregnancy or after weight loss. So it's really improving people's lifestyles with the art and science of plastic surgery.
So what is the most popular procedure that you do in your office in Beverly Hills?
Most of my practice is focused on breast surgery, corrective breast surgery, or reconstructive or cosmetic. I get referred a lot of patients from everywhere to repair surgery that wasn't done properly or optimally. I also do a lot of body contouring, like tummy tucks, liposuction, the very popular BBL, and some types of facial surgery.
Boy, I need to come to you real quick. Express plane flight there. Okay. So that's the most popular. It seems like everything really across the gamut, doctor, you do, with regard to plastic surgery.
Yeah, with this focus on more complicated breast surgeries.
So tell me about the situation where people take international trips to save a buck or two. And why do you think, people do this, and why is it not such a good idea?
Well, this has become a huge business globally. Medical tourism itself, not even plastic surgery, there's between 10 to 20 million people every year flying all over the place for medical treatments. Of that, a smaller, but still a large number of patients go for purely cosmetic surgery, primarily because they want to save money.
Yeah.
And I categorize it as Americans traveling abroad or just traveling in general. I have a lot of patients I see from elsewhere coming here. I've seen patients fly to Dominican Republic, Mexico, Thailand, Turkey, all over the world.
Brazil.
And I see a lot of patients flying from LA to Miami. It seems to be a whole liposuction factory there. So all of these I categorize as high risk plastic surgery, especially if you're going abroad. And the main issue is plastic surgery is a very complicated process. Mm-hmm. It's not like going in and getting an oil change for your car. You got to know if you're a good candidate. if you're with the right doctor, having the right surgery at the right facility, and you're set up for the right recovery. And at the end, you should really focus on the finances. Is it worth the price? And unfortunately, when you're dealing with plastic surgery tourism abroad, you're really focused on the brief experience of the surgery and the price of that, and you really have no control over the rest of it. And there's been a lot of horror stories about this. In fact, the Associated Press just published last month 99 cases of death just from the Dominican Republic.
Wow.
Since 2009. And that's a scary number. And that doesn't even include all the other countries, especially Mexico, which is very popular for our clientele in California. So it is pretty alarming for us to see patients seek dangerous plastic surgery or any healthcare and then come back with all sorts of problems.
So why is it dangerous going abroad? Is there any kind of board certification in these countries, or is it just New York that provides this board certification for safe practice?
Most Western societies, meaning North America and Europe and many Asian or even Middle Eastern countries, have equivalent board certifications to the U.S. We have an FDA that tells us what treatments are appropriate. We have credentialing bodies that tell us what kind of facilities, surgery centers, and offices are safe. And then there's very rigorous criteria for what kind of doctors can do what procedures and whether they're qualified and what protocols to follow. In many countries, we don't have those options. It's strictly driven by financial gains, and there's really a race to the lowest price because labor is so cheap. So not knowing the qualifications of surgeons in many of these destinations or the credentialing of the facilities are issues, and whether safety protocols and regulations are in place. And most importantly, you have no recourse. In the U.S., we have a legal system. We have steps to follow if something goes bad, and the doctors and facilities have to be held accountable. In many other countries, you have no options, so you don't have any recourses. So that's why you have to be very cautious when you try to pursue any of those travel for plastic surgery.
So what have you found? Is there a problem when you are getting plastic surgery out of the country? Is it a problem with infection? Is it the incorrect procedure that occurs? Or is it the materials that are used that are inferior? What is exactly is missing or lacking in these other countries that really make them subpar to what?
Jeanine, that's a quick question. In fact, the American Society of Plastic Surgeons and other American societies have researched this, and there's been publications. There's a recent one where they looked at 20 surveys and research studies across the country. And by far, the number one problem we see are serious infections that are just left neglected. And by the time they come back home to the U.S., these infections are so serious that half of them require hospitalization, and about a third of them actually require surgery to fix it. And compared to having complications here in the U.S., here in your hometown, these infectious complications are much more serious, much more advanced, a lot more costly. And we've seen that they come back home with stranger, more resistant bacteria. So there's a host of serious problems specifically with infections. There are other issues as far as what happens if you have major surgery and you travel. You're at high risk of the wounds breaking down, stitches coming open. You have a much higher risk of getting blood clots. which is one of the number one actually killers and complications after major cosmetic surgery. So there are a host of serious problems when you're having major surgery elsewhere. And even in the US, I've seen problems when people travel for a quick in and out to a facility which does a ton of these. The aftercare and the supervision is really substandard. And on top of it, you add the risks of major travel. So that's where we run into serious problems.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and my guest today is board-certified Beverly Hills plastic surgeon Dan Yemeni of Visthetic Surgery Institute and MedSpa. Dr. Yamini is alerting us to the dangers of foreign cosmetic surgery versus the relatively safe and controlled surgical environment normally found in the United States. Another question for you, and I think that this is something that I think we're all wondering. How often is your practice reoperating on patients because their first surgery was done incorrectly, and you have to take them in and you have to figure out how you're going to make better a bad surgery that was done out of the country?
That's a good question, because I've been in practice for 22 years now. And as the years go by, we become more and more a referral center for other doctors or from other patients, word of mouth, where surgery hasn't been done well. I would say right now, probably 50% of my patients have had previous plastic surgery.
That's a lot. It's high.
Mostly in the US by good surgeons. And I'm not saying there's necessarily bad complications or they were done poorly, but plastic surgery inherently needs to be changed over time. Mm-hmm. Okay. It will never look perfect and beautiful and just right forever and ever. So at some point, most of what we do has to be repaired. And that's a much more complicated process. It requires a lot more experience. So that's why the older you get and the longer you've been doing this, the more frequently we see patients who need revisions. Specifically, when it comes to tourist patients who've gone elsewhere and they come back, thank God I don't see a lot of them, because we have a lot of good surgeons in my practice here in this community. We have a relatively affluent community who are aware of the risk of abroad. So mostly they get surgery here in the States. But the people I've seen from abroad, they've had issues where there was really no recovery. They never saw the doctors after surgery. Compare that to me, I see patients very regularly for up to 3 months for a routine procedure. So when you don't see the doctors ever after surgery, you're kind of abandoned. Mm-hmm. So they're calling me asking, hey, what do I do with this? What do I do with that? Is this normal? Is that not normal? And if they don't heal well, whether it's a serious complication or not, they all end up having to come back to a qualified doctor, and we have to kind of hold their hand and walk them through steps to recover or to fix problems. So it is a serious problem. Even if it's not a life or death emergency, it's a real pain in the behind to have to deal with improper or poor recovery from lack of aftercare.
So what would you say to bargain seekers, people who say, I just can't afford, my BBL or my breast implant surgery or my tummy tuck? What would you say to these people?
I would say, first of all, go get 2 or 3 local consultations from board-certified plastic surgeons, okay? first make sure you're a good candidate. Then make sure you actually have the right plan, the right surgery. You'll be surprised how many patients feel like, oh, I need a big tummy tuck or I need a big BBL. And honestly, they don't need as much surgery. Or frankly, it may not be as expensive as they want. Once you've found the right surgeon at the right facility and have the right plan, virtually all practices offer very affordable financing dedicated to cosmetic surgeries or medical procedures. And with just a little bit of saving and planning this out over a period of time, I think that's far, far better approach and much safer if you do it locally.
Do you ever take insurance for certain procedures?
In some cases, if a procedure is medically necessary, if it's due to an injury or congenital problems, or it's health related, yes. But most of these tourism that we see are done entirely for elective cosmetic patients, and neither here nor abroad does insurance cover it. And in fact, if you come back home with complications, your insurance company may not cover you for treatments and hospitalizations that can get very expensive because you did a purely cosmetic procedure out of pocket.
Have you ever turned a patient away, because the surgery was so badly done that you felt, this is inoperable, I can't fix this?
Yeah, unfortunately, once in a while, we do see cases where there's really not much more room for improvement. If you really overdo a surgery, if you remove too much and you really haven't left behind enough healthy, viable tissue, then we have to say, look, there's not a lot we can do to completely fix it or bring it back to normal. Oftentimes, we can make small improvements to help the patient at least feel a little bit better and feel a little more healed. But yeah, regretfully, there are cases where it's just really overdone.
Yeah.
And we have to turn patients away.
What about language barrier and culture when it comes down to going outside of the country, trying to communicate to your surgeon and or physician about your desires or your needs? You said that you were a surgeon, but then a psychologist as well, because there's a certain communication component to what you do. What about if you're going to another country and that country that you're going to, English is not the dominant language, and so you're trying to convey to the surgeon what you want? What are your thoughts about that?
That is a huge problem. Unfortunately, as I mentioned at the top, this plastic surgery tourism is a big business. It's the equivalent of going on a cruise ship and going on a safari, or they're very much catered to English-speaking clientele from the West, and they organize it like it's a vacation.
Right.
They plan the airfare, the hotel, the whole stay, and they mistakenly give you the idea that, oh, you can go on this nice journey and vacation and enjoy the whole surgical process. But that's really not accurate. So surgery is very serious business. It's complicated, and it should not be equated to a vacation. So by the time you get there, most patients tell me they never really discussed anything with the surgeon or met the surgeon. So it's critical to communicate directly with the surgeons.
Okay, doctor. Another question that I have, can you provide some examples of patients who have come in, who have experienced complications, whose surgery was done internationally? Is there a particular example that sticks out in your mind? And what kind of surgery was it?
Actually, the best example I remember is a woman who actually was one of my old patients. I had done some very nice breast surgery on her many years ago, and she was very satisfied. And she got married, and she decided to have more surgery on her body as she was aging. And she saw me, and I said, "Yeah, this is, you need some liposuction and a tummy tuck." And a year later, I found out she'd gone to the Dominican Republic,
Oh,
which
boy.
is a huge destination. And she actually did not get, butchered or have serious complications, but she kept repeatedly have to come back to me to take care of issues with not healing well, sutures left behind, scars that had to be fixed, cosmetic problems, and ultimately she was unsatisfied. Thank God her health wasn't seriously affected. So this is just a cautionary tale of what we see in the U.S. all the time. Patients traveling, especially to Mexico, even Brazil. Another terrible case I saw was a woman who went to Brazil, had butt implants put in, and she had very serious complications. They had to be removed,
Wow.
and she was left with very permanent disfigurement. Another woman had illegal, unauthorized silicone shots in her face, and it really eroded the cheeks, and there was serious infection, and she came to us on an emergency basis, and we had to drain it. So these are all very common examples of what we see, patients flying in real quick, getting treatments that would not be allowed here in the U.S., and then just abandoned. And
Wow.
then they're just scared, and they seem hopeless, and they don't have a support group. So yeah, it is very unfortunate.
It is. And did they have any legal recourse coming back to the States?
As far as I know, no.
No
They're
legal
a different
recourse.
country, and it's a totally different jurisdiction. And I suppose they could try getting legal representation in another country, but they're dealing with so much stress and trauma here, and I'm sure it's not affordable, to go there and pursue that. And even there, even if they can get legal action, it's unlikely that they're going to succeed because the laws are very different.
So, in getting plastic surgery, how long typically does it take for a person to heal before they get on their feet, before they walk around and get on a plane? How long does it take for them to heal?
So for a lot of my patients who fly in out of town, depending on the scope of the surgery and the type of surgery, I tell them a minimum of 7 to 10 days for a routine surgery. They need to stay here at a proper aftercare where trained nurses and professionals can kind of oversee them. They see me very regularly. And then once they go back home, I actually do Zoom calls, and I do follow them up and make sure they're properly healed. And, God forbid there's a problem, they have somewhere to go, or they come back. If somebody's having very major surgery, we see a lot of patients from the Middle East. They come and stay for 1 month, 2 months, even 3 months with their family. And in that case, then I think it is safe and reasonable to do medical tourism, or kind of reverse medical tourism, coming here. But the reverse of flying in, barely having any interaction with the surgeon, getting a quick surgery, and then just left to fend for yourself, basically abandoned by the doctor, that's where the serious problem is.
You spoke about some plastic surgeons in Europe and other places where it may be safe to have plastic surgery, right? So what certification am I looking for if I'm going to go and fly maybe to France?
Well, they have
a similar.
They have equivalents. For example, the fellow of the European Society of Plastic Surgery. They have the equivalent of the American version of that. And it is recognized by some of the plastic surgery societies here that, yes, you're fully trained. Most people, however, don't go to, for example, France or Germany or England because the prices are not that much cheaper. The one country where it's become very popular to have plastic surgery, specifically hair transplant, is Turkey. That is the one exception to the rule where I have repeatedly seen good results, safe results, reliable results, because hair transplant, for example, is very automated. There are very clear guidelines globally on how to do it right. And these centers who do a lot of it, they do a pretty good job at a fraction of the cost compared to the US. But other than that exception, I don't really see a huge benefit of going to Thailand or South Korea or other countries when you have access to really excellent care, reliable source, and you have recourses if there is a problem.
So how does one get in contact with you, doctor? If we had questions or we wanted to know about your practice, we wanted to come to you for surgery.
Visthetics, yes, you can go to our website, Visthetics Aesthetic Institute and MedSpa here in West Hollywood, or you just Google my name, Yamini. There's only one of me, plastic surgeon here in LA, and we'll be happy to help you and guide you either here or anywhere in the world.
And what is the one thing you want to leave us with, if you had to leave us with one thing?
Plastic surgery is a very serious endeavor. It can be amazing, but please take it seriously, do your homework, and don't do shortcuts.
Well, thank you for being here, board-certified Beverly Hills plastic surgeon, Dr. Dan Yemeni of Visthetic Surgery Institute and MedSpa. We thank you for giving us this very important information, and we hope you continue to stay healthy and to keep doing the great work that you're doing.
Thank you, Jeanine. It's nice to be with you.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.